As creative people, we arts therapists are always looking for innovative ways of working. So when we were planning an art psychotherapy group for 18 to 25-year-olds, we thought how great it would be to hold it in an inspiring community setting like a museum. We wanted the participants to feel valued, and we also wanted them to feel connected to the world outside mental health services. We also thought that the objects might help the participants to reflect on their feelings and experiences, and we hoped the overall setting would encourage them to express themselves creatively using art making. So last year we ran an 18-week group in Gloucester City and Folk Museums, and we were really encouraged by the response from service users. We're now running a similar group for adults of all ages in the museum in Stroud.
Doing art therapy in museums is different from normal art therapy. It's in a public space, so it feels less clinical, more relaxed, and you feel like you're a real person working on your own personal goals. Being in a museum helps bring out your creative side. You get a chance to see a wide variety of exhibitions, both historic and modern, which brings excitement and helps bring out your creative side. Being in a museum helps you think outside the box and see things from a different perspective. You get the chance to see things that you wouldn't normally consider relating back to your own life, which gives you a new insight into your thoughts, feelings and experiences.
I think allied health professionals have a strong set of values around meeting the person wherever they are on their journey. We work with people to find out what hopes and goals really matter most to that individual and to those close to them, and then put our skills to work supporting that person's efforts to achieve them. My area of practice in the Recovery College is all about that. It's not about telling people what to do to recover. It's about creating opportunities for them to find out what works best for them, often from others who've shared that experience themselves. It's also about us as professionals seeing a person's strengths and potential and helping them develop those to achieve the rewarding life that we all want.
People who suffer with mental ill health are much more likely to suffer from physical health issues than people who don't suffer from mental ill health. This can include problems with respiratory, vascular, musculoskeletal systems, as well as neurological problems, extending into and beyond dementia and falls. Alongside our health and exercise colleagues, we're in a privileged position to integrate both mental and physical good health philosophies. So we look to apply our broad physical health expertise and work with our service users to make improvements primarily in physical health where we can. But the positive consequences of this extend far beyond the physical effect of improving balance or improving exercise tolerance. The cooperative relationships we form can help improve confidence, promote social inclusion, reduce significant pain and hopefully prevent people's physical health problems from stopping them living enjoyable lives.
Allied health and psychology professionals work alongside medical and nursing colleagues in our inpatient hospitals. Our job is to enhance people's experience while they're there. We know that needing to be in hospital for treatment can be a difficult time for people, so it's really important that we do what we can to make sure that their stay with us is a really positive experience. Our expertise as allied health and psychology professionals helps to ensure that there's a hospital-wide approach to things like meaningful occupation, to ensure that people's physical health needs are met, and to encourage people to own their own recovery. We think that therapy services really are essential to hospital provision, but we also know in this current climate that we need to make sure that they're fit for purpose, that they're led by the needs of service users, and that they're always really high quality. To do this, we make sure we gather feedback from patients and their carers and the staff that we're working with, and constantly review our services and make changes where we need to make sure that they're as effective and as efficient as they can possibly be.
We go to Form Me About Me group to provide the ED reading leaflets, and we provide the words to be made easier and accessible for those who can read it. We have to make sure that the language is clear, easy to hear through, and that we have to wait for them to speak, because if we interrupt, they get frustrated, anxiety and very angry. It's not easy to represent other people's feelings because everyone is different.
I think that because AHPPs are generally the minority group in healthcare settings, strong leadership's really important so we can raise our profile and celebrate the unique contributions that we bring. In Together, we're in an unusual position because we've got allied health professionals on both the exec and the non-exec teams. The heads of profession are in the senior leadership forum, and I think these things combine to give AHPPs a really strong voice when discussing direction and strategy for the trust. I think we've got amazing AHPPs throughout the organisation, and all of them demonstrate leadership at one level or another. This can include care coordination or leading best interest meetings, and I personally see developing the leadership skills of my team as one of my core roles.